Hello, yogis. Today we are going to talk about contraindications in yoga. And it's a complex topic with honestly not a lot of clear evidence or guidance. And in fact, this is an area where every year I seem to get different guidelines from yoga and fitness organizations that my courses are registered with. So I can see how it's a challenge for teachers to have a really clear understanding of contraindications, but today we're going to have a go. We're going to talk about a couple of things. Yoga poses or techniques that are generally considered contraindicated for particular conditions or health issues, poses that are contraindicated for particular environments, and we're going to talk about the risk to benefit spectrum and how that might guide you in making choices for your own classes. And our focus, of course, is to provide a safe and accessible class and to encourage agency and self-knowledge and supporting our students in making conscious choices in their own practice. One of the things that I want to mention is that contraindications often revolve around individual needs and comfort rather than strict across the board limitations. So we're going to talk a little bit about how to provide options, variations, props for each unique person in your class. And so we'll explore some of the common conditions that our students might be experiencing as they come to class, things like back pain, sciatica, dizziness, frozen shoulder, carpal tunnel syndrome. And I hope through this discussion, we can shed light on adaptive strategies to help us to guide a safe and inclusive yoga experience for all practitioners. A couple of important things to begin. We're going to have a general chat about common contraindications that does not replace the guidance of each student's health or medical team, right? We're not doctors, we're not physiotherapists, we're not knowledgeable enough about specific students or specific conditions to advise people what to practice and what to not practice. That's the role of their medical team. So two guidelines to keep it top of mind. Number one is, if in doubt, refer. If you aren't sure your class is safe or suitable for a student with a medical or health condition, refer them back to their doctor for clearance and guidance, right? Number two is, if in doubt, leave it out. If you aren't sure a pose or a pose version is suitable for a student or environment, leave it out. Find another pose or pose version that will suit, right? So those are two things to keep top of mind. You might even jot those down. So let's dig in. So what does contraindication mean in yoga? So a contraindication is like any health or medical condition or limitation that could make a particular pose or pose flow or technique or activity harmful. It can also talk about a specific pose, pose version, technique that reasonably should not be practiced because it may be harmful to an individual or to a general group. So for example, when we talk about individuals, that might be people with high or low blood pressure, bone or joint problems, dizziness, osteopenia or osteoporosis, arthritis. It could relate to pre or postnatal students, people with hernia, glaucoma, joint replacement, particular medications, mental health like PTSD, anxiety, or panic disorders, and also any past issues with movement or breath work or meditation. Okay? When we talk about contraindications for general groups, that might again include pre and postnatal students, kids, older adults, people who are undergoing medical treatment, like things for cancer or other medical conditions. And contraindications can also relate to a particular environment where certain poses or techniques might not be used due to a higher risk of injury or just not being suitable due to population or available equipment or environment or even expectations, right? So a couple examples of that are, if you're teaching with no props available, right? You might make different choices. If you're teaching outdoors, if you're teaching in an environment that's either quite hot or quite cold. You're going to make different choices. And where you're teaching. So if you're teaching in, say, an aged care environment, in a recovery center or detention, in schools, any institutional environment, you might make different choices about what techniques you're going to use in your class. And that can even include places like fitness facilities and gyms. So for many years, the fitness industry considered a number of poses contraindicated for the gym environment. And those included things like headstand, shoulder stand, plow, upward facing dog, locust, upward bow. And those contraindications changed year by year. At the moment, there's no definitive list of poses, at least not that I'm aware of, that are considered completely contraindicated in the fitness industry at large, but may be considered too risky. So on the risk to benefit spectrum. And so I'd recommend be guided by your specific gym or fitness facility, or be guided by your insurance provider as to what to offer in these different spaces. So let's talk about the high risk, low reward, or low benefit spectrum. So risk reward or risk benefit is a comparison between the potential risks of a situation and its potential benefit. So in yoga, the potential risks of a technique, so an asana, a breathwork technique, a meditation, and its potential benefits. And in yoga, it's my view that we err on the side of caution and we err on the side of benefits rather than risks. So choosing less risky, more beneficial techniques, particularly in a group class environment. There are really no techniques whose benefits outweigh potential risk, because there's always another technique or pose version that could be less risky and still maintain the benefit. So we want to err on the side of safety and caution and finding the safest and most beneficial techniques for our students to be practicing. So that's something to keep in mind. Let's talk about general contraindications and considerations. So I've been working on this for a while now. I've done my best to put together a list based on my learning and what information is generally out there at the moment, but it's a challenge, I'll admit. It's a challenge to find really clear evidence-based guidance out there at the moment. And yoga is full of medical misinformation, biomedical miracle claims, and ideas of contraindications that are really faulty and kind of old-timey, like don't do inversions when you're menstruating. So it is a challenge to put together a list, but I've done my best to put together a comprehensive list of contraindications, given those challenges and given the challenge that a lot of times contraindications depend more on the individual and the pose version than like a strict, no one can do this pose kind of list. But so I've done my best. And I do look forward to continuing to learn in this area, and I hope that we can learn together. So many of the suggestions on my list are really just about letting people know that if they have discomfort, if they have concern, if they've received medical guidance not to do certain things, we can offer versions, options, or props so that each student can find their place in a pose, right? One more note before we get into the list. All of the conditions we're talking about should be assessed by a doctor prior to practice, and students should be informed by their medical team or health team about how to practice, and about what to reduce or modify or avoid to keep their bodies safe during practice, right? So we go back to those two rules. If in doubt, refer. If in doubt, leave it out. Okay, let's dig in. So first, we'll talk about high blood pressure. So for people with high blood pressure, the guidance is that they take care of poses where the head is below the heart. So that's going to include poses like standing forward folds, downward dog, any inversions. And also, I'd recommend that for students with high blood pressure, that they are guided to take care with poses where they might hold their breath or strain. And that might come in poses like boat or plank. So encouraging those students to work at a level where they can maintain the flow of their breath. Okay, so high blood pressure. Okay. Next, low blood pressure. For people with low blood pressure, the guidance is to take care with poses where the head's below the heart, just like high blood pressure. Particularly poses like wide leg forward fold. Often the challenge for people with low blood pressure is coming out of that pose where they're going to experience dizziness and maybe some disorientation. So taking care to come out of that pose maybe in a few steps. For low blood pressure, also poses where you go up and down a lot. So sun salutations. They might be guided to take extra time, extra breaths, or choose to do things like wall salutations or chair salutations if they're experiencing a lot of discomfort from low blood pressure. Next, osteopenia or osteoporosis. The guidance here is to take care with any really deep poses for particularly the spine, things like deep twists, poses where there might be body weight on the spine, so like bridge where the body weight is on your neck, and any pose that puts the body into deeper stretches. For someone with diagnosed osteoporosis, they absolutely should have medical clearance before attending a yoga class. And their medical team should be giving them some advice on how to practice. And then our advice is to practice within a safe range and to use the props and supports that can help them. Next, pregnancy. So this is a really big topic, depends on the trimester, depends on the person. But the general guidance is to take care with poses that compress the belly, take care with poses that might overstretch joints, and to maybe reduce or avoid or modify any prone, so lying on your stomach, or supine, lying on your back techniques. Temperature is a key concern, especially in really hot months. So making sure that prenatal students can maintain a safe temperature and maintain hydration. And then a good guideline is just to reduce overall intensity and either reduce or modify, all strong poses, particularly inversions, right? With prenatal students, I think it's a good idea to check in with your insurance provider. In Australia, over the years, this guidance has changed quite a lot. Some insurance providers do not cover you for prenatal students if you don't have prenatal specific training. If you have concerns about prenatal students in your class, I'd recommend having a referral list so you can refer them to a prenatal class that will meet their specific needs and provide a beautiful space for them to be practicing yoga. So if that's a concern for you, those are a few tips. Next on my list is pelvic floor injury or pelvic floor dysfunction. The guidance here is to take care with poses that put downward pressure on the pelvic floor. And that's going to include poses like plank and boat. If you're working with a lot of students with pelvic floor injury, or you want to work specifically with that population, there are courses that I forget the name of right now. Is it called Pelvic Floor First? There are some courses that you can take that will give you some good general guidance, especially if you're going to be working with a lot of prenatal students and postnatal students. This might be a good course to take to sort of get all the guidance in that area. And I'm sure that there's resources out there for you. Next is hernia or any gastric issues, ulcer. the guidance here is to reduce intensity overall and avoid movements that compress the core. So that's going to be things like child's pose, boat, Kapalabhati breathing, and even things like our deeper forward folds where the belly's really compressed. We might take those into wider leg forward folds, whether it be standing or seated. You want to take care with things like lying on the belly in poses like cobra and locust to reduce pressure on the belly. So again, that's hernia, gastric issues, ulcer. Next is on my list, sciatica. And I'm going to include in here high hamstring tendinopathy. High hamstring tendinopathy, you can Google it later. We sometimes call it yoga butt, is an issue of the tendon that attaches the hamstrings up into the pelvis, which is a common concern in yoga. So for both sciatica and high hamstring tendinopathy, the guidance is to take care with deep forward folds and to not bend the knees in forward folds. When we bend the knees in forward folds, it allows us to have deeper hip flexion, and deep hip flexion is the thing that we want to avoid for students with both sciatica and high hamstring tendinopathy. So that's something to think about. If you've got questions in this area, I've got some great resources I can point you to. What is next? Hypermobility. If you've got students in your class who are hypermobile, the guidance is to reduce the depth of stretches and encourage strength and stability. So pulling back out of extremely deep poses and looking for a place where they can work on developing a little bit of tension, a little bit of stability. Next. So I've put this into a package too. Dizziness, which could come from a lot of areas. If someone's reporting a lot of dizziness, they need to be referred back to their doctor. But general dizziness, inner ear issues, POTS, the guidance is to use support when balancing, to keep your eyes open, especially in balancing poses, and to reduce intensity of poses that cause discomfort. And again, that might include flows that go up and down a lot, like sun salutations, coming out of deep forward folds, like our standing forward folds, our wide leg forward folds. So working next to a wall, having a chair nearby, or taking extra breaths to come and go out of those poses are all things that are recommended. Yeah, so if someone's feeling really dizzy, say they're in a sun salutation flow and feeling really dizzy, then yeah, coming into child's pose might be beneficial to let them get oriented, check in with themselves, see if anything serious is going on or they're just experiencing some general dizziness. For people like me with POTS, we get dizzy a lot. We kind of know that it's just dizziness. So I'll come down to hands and knees or to child's pose. If a student is getting really dizzy and like pale and clammy, stop the class, get them medical attention. Someone's accustomed to their dizziness. Yeah, child's pose is a good place to advise them to go, or any pose where they feel comfortable, to find some stability so that they can regulate. And yeah, I don't want to go too far into this. We don't know what's going on with someone's health and medical situation. But if in doubt, get someone on the ground and check in with them. And if you're concerned, if someone looks like seriously really pale and clammy, end your class, move everyone out, call an ambulance. Yeah. POTS is one of the conditions that people with long COVID commonly have. So we're seeing it more and more in yoga classes. Sorry, can I talk about that just for one more second? If someone's commonly getting dizzy in sun salutations, find other sun salutations for them to do. chair salutations, wall salutations, moon salutations, so that they're not going up and down and getting dizzy in every one of your yoga classes. Hydration matters. So if someone frequently gets dizzy in class and you've already referred them back to their doctor, the next thing to do is make sure that they're well hydrated, and temperature matters. So making sure that they're in an environment that's really hot. Maybe in cooler weather, they're good with sun salutations, but in hot weather, they need to modify, right? You might print out a handout of an alternative sun salutation for them to work with where they're not going up and down so much. That can be useful. Frozen shoulder, which you're going to see more commonly if you work with older women going through perimenopause and menopause. It's quite common. And so reducing the size of shoulder movements to whatever's comfortable, and consider accessible options for any arm balances. And that includes things like downward facing dog, right? So instead of downward dog in a sun salutation flow, you might come to hands and knees and do a cat cow instead of holding a down dog, right? So it's really quite easy to make that more accessible. For me, if I have a student come in who says, I've got frozen shoulder or rotator cuff syndrome or bursitis, or I've got something going on in my shoulder, I might ask them to show me a comfortable range of motion. So I've got a sense of what adaptations are going to work. So if someone says, oh, like I can't go higher than this, well, then I know like downward dog's out, hands on the hips for things like powerful pose, warrior one. Like, you can think about what range of motion's available and then what options are going to work. If someone says, oh, I can't go any further than this, it's like, okay, well, let's try some things. If you find discomfort, then we'll look at options, right? So getting someone to show you their comfortable range of motion can be really useful for you to then think about versions, adaptations, props, and other options for them in their practice. Yeah. The same goes with carpal tunnel syndrome. So carpal tunnel syndrome, an issue in the wrist, we want to reduce pressure on hands in arm balances, and also use alternative poses. So maybe downward dog, you're working on the elbows instead of the hands. Maybe for things like our warm-up sequence in hands and knees, you'll use seated poses or standing poses instead of working on hands and knees. For some students, it's enough for them to use some support under the heels of the hands to reduce the size of the movement at the wrist. So when we prop up, reducing that angle. For other students, staying off the hands is the best option for them. So you can work with each individual student on that. But the general guidance is to reduce pressure on hands and wrists. And so that might mean that they use the half standing vinyasa and the hands-free vinyasa instead of sun salutations, and then finding alternatives for things like our hands and knees warm up and our arm balances later in the practice. Similarly, for people with osteoarthritis, depending on where they're experiencing that, the guidance is to use supportive props. So if there's issues in hands and wrists, propping up the heels of the hands. If there's issues in the knees, providing some cushioning under the knees. The general advice is to take extra time to warm up. So if you're working with a lot of your students have arthritis, and we all will go through arthritic change as we age, or joint change as we age, taking extra time to warm up, having supportive props underneath joints when we're bearing weight on the joints. And in general, just, taking extra time to consider how we'll bear weight on our affective joints. Those are some things to consider. So you might reconsider things like kneeling lunges, which can be very strong for people with arthritis in knees and hips, and arm balances, which can be very strong for people with arthritis in hands, wrists, shoulders, things like that. Okay, next, glaucoma, eyes. Taking care with poses where the head's below the heart is important because it's going to increase pressure. That includes standing forward folds, that includes inversions, it even includes downward facing dog. So these students might use hands and knees instead of downward dog so that the head isn't going below the heart. Using a cat-cow instead of a downward dog can be a useful adaptation there. Knee pain. Knee pain is complex. Why? Why the knee pain? Do they experience knee pain in flexion, so bending the knee? Reduce flexion. In poses like child's pose or where we're kneeling, you can put a prop under the knees if there's discomfort in kneeling on the ground. You can put a prop behind the knees to reduce knee flexion. So say you're using a pose like child's pose, putting a prop between the back of the thigh and the back of the calf is going to provide some support and cushioning, reduce the size of the movement at the knees, and generally reduce or modify any poses that cause discomfort. Common poses that can be contraindicated for knee pain or knee replacement are child's pose, lotus or anything lotus-like. Even easy sitting position can cause some discomfort. So those students might use props underneath the knees or sit in seated angle as opposed to easy sitting. Kneeling lunges again, pigeon or anything pigeon-like. Any really deep flexions, so like hero, reclining hero, stronger knee rotation. So again, that's lotus, anything lotus-like, pigeon, and kneeling in general for people with knee pain. Often kneeling in general can be a challenge. If you're working with lots of students who have knee pain, especially the knee pain when you're bearing weight on your knees, I recommend adding a prop to your props list. And you can get these at like Kmart or Aldi. They're little gardening pads that are just like gushy foam. And often they're about this size and they have like a little cutout handle, easy to slide in and out. You can buy really expensive ones from yoga props manufacturers, but you can get inexpensive and very useful ones from anywhere that sells gardening tools, and they're to kneel on when you're gardening. So if you have lots of knee pain, you want to add something to your props toolbox yourself, or you're working with lots of students who need this, that's a really easy prop to use. It's easy to slide in and out. Of course, you can use a folded blanket, but a folded blanket can be sometimes difficult to move in and out of the way. And I find when a prop is difficult to use, or students feel rushed, or they feel like they can't get their prop in place in time, then they might not use it. So the trick is to, first of all, make sure that students have time to consider and then use props. And number two, have lots of props available that they might find helpful and enjoyable, right? Okay, next on my list is joint replacement. First and foremost, students should be guided by their health team about safe range of motion. Joint replacements like hips and knees can vary quite widely with each approach. So there's different ways of doing a joint replacement, an anterior approach, a posterior approach. There's different kinds of joint replacements, like the actual thing itself. And so there's a difference in how each student is going to return to movement, and they should be guided by their health team on that. In the case of some hip and knee replacements, those shouldn't be taken beyond 90 degrees of flexion. So students should be informed about that from their health team, and we want to be there to back that up and provide options for them to do that. That might mean using extra props. It might mean doing poses in chairs. And so giving students the support that they need to return to movement, have an enjoyable yoga practice without taking those joints beyond their recommended range of motion. It is a good general advice to avoid or modify really strong poses like pigeon, half spinal twist, mm, anything in the Marichasana series for people with joint replacement. But again, students should be receiving guidance from their health team and coming to class armed with information about what they should avoid for their particular situation at this particular time, right? Last on my list is back pain. And this one's tricky because it's a really big category. What kind of back pain? What intensity? What cause? For how long? Um, it's really hard to know with each individual student what's going to work best for their back pain. For things like disc herniations, acute sciatica, recent surgeries, any diagnosed spinal conditions, so like stenosis, rheumatoid arthritis, degenerative disc disease, students need to be referred back to their doctor if they haven't been there already to get some guidance about how they should be moving to support their back. If a student's medically cleared for yoga or fitness or exercise, whatever discussions they've had with their health team, we want to follow any guidance that's been provided by that health team and work together with the student to find versions of poses that allow them to challenge their bodies within a comfortable range, right? So it might require some individual discussion. General guidance is to take care with poses that put excessive strain on the spine or put the spine in an unstable position, right? It's very hard to give general guidance though, because back pain is a really broad category. But some common poses that may be contraindicated that you might want to find versions, adaptations, props for are things like upward facing dog, instead using Sphinx or Cobra, upward bow, instead using bridge. Warrior One can be really challenging for people with back pain, so reducing the size of that movement or using a crescent lunge instead. Triangle can be a tricky one, so you might consider replacing triangle with something like side angle if it's causing discomfort. So a lot of this is about working with a student and finding what's going to work best for them. It's a big category. I feel like it's really hard to provide general guidance in this area. What are the riskiest poses? So we talked a little bit about the risk to benefit analysis. And as I said, there's no pose that has so many benefits that it's worth potential risk. So if it's a student, a class, an environment that looks like it needs to stay on the safer end of the spectrum, stay on the safer end of the spectrum. There's no intensity that's so beneficial that it's worth potentially risking your students' health and well-being. And so what are the riskiest poses? Now, this is a difficult conversation because risky depends on a number of factors. Someone's health conditions, obviously. Someone's regularity in practice is going to determine risk. Someone's fitness and adaptations to yoga, strength and flexibility, posture, your ability as a teacher to provide step-by-step guidance in stronger or more complex poses, right? So there's a lot of factors when we're talking about risk. So for this, let's talk about the general yoga student who attends irregularly. Maybe they drop into 1 or 2 classes a week. They don't get a lot of time being educated in yoga. So if someone's coming to your 60-minute flow classes, they come in, they flow, they leave. If you are going to include this list of poses I'm about to give you, you do need to progress those students intelligently and provide solid step-by-step guidance whilst offering options and versions. So these poses are shoulder stand, headstand, plow, lotus, upward bow or the full back bend, chakrasana, breathing techniques, Kapalabhati, shining skull breath, or Bastrika, pranayam, bellows breathing. To me, it's self-evident. Anything with legs behind the head, anything putting a lot of pressure on top of your head, anything in an environment where students might be falling over and knocking into each other or into equipment. We want to show, caution in those environments. If you want to teach those techniques, there's nothing inherently dangerous about these techniques. It's just that have students been prepared for these techniques through regular practice? Have they had an education in how to move into these techniques? Do they know their bodies well enough to move into these techniques? And is there space and time available for students to approach these safely and steadily, right? So they're not necessarily never do these. I'm not saying never do these poses. These are great poses with great benefits. We just need to consider in the modern context of students dropping in and out of our 60-minute classes, is this the environment for this pose, right? So to include any new pose, but particularly a complex pose, you have to make time for it and guide your students towards it intelligently, right? Ensure that you've got the props available. So for poses like shoulder stand and headstand, that's going to include lots of blankets. It's also going to include walls. A lot of times we don't have walls to work with in our yoga classes. So you want to make sure that the environment is right, and that you've got the time and space to do this. I think it's worth also knowing, do my students want to do this? Because we might be really enthusiastic about teaching our students how to do handstands and headstands, but is that why they've come to yoga? Are they willing to give up 15 minutes of a 60-minute class to work on this pose? Or are their goals for yoga and their needs in yoga different? So this is about communicating and working together with your students, and moving towards whatever their goals are, right? The reason in my yoga teacher training, I used to teach all of these poses, and I stopped because they just weren't working in a modern context, in 60-minute drop-in, all levels yoga classes. So if I were going to be teaching these poses in my classes, I'd be teaching them in longer classes, and I'd be teaching them in classes that were oriented around advancing students. So they would be marketed towards, these are classes where we're working on advancing or developing our practice, as opposed to my general all levels flow classes. So that students know what to expect, they know what they're in for when they come to class, and they're signing up to spend that extra time being educated in yoga, working step by step, trying different versions of poses, rather than students who just want to come to a class and get a little bit stronger, a little bit more flexible, and have a nice long juicy shavasana, right? So it might be that if you're including these, that you set aside specific classes for that students can enthusiastically sign up for, as opposed to classes where you're taking time out of a class where students are sitting around going, I can't do that, I don't want to do that, and waiting while everyone else explores this fun thing. One of the reasons I say that is because it's one of the reasons my mom stopped going to yoga classes, because her teacher was super enthusiastic about advancing her students' practice, and some of the students wanted to go on that journey and some didn't. My mom was one of the ones who's like, I just want time for myself every week to like move and stretch and relax, and I don't want to hold someone else's ankles in handstand. Like, it's not why I came to yoga. So that teacher lost students by putting that kind of workshopping into a general class, which you may not do. It might be that all your students want to do that, but I think it's worth considering. Is this the environment for this kind of play or these kinds of poses? And if it's not, and you're really keen to teach them, that's where you can organize specific classes for that work. how did it get into your practice? Like we definitely, that was a method that we used for a long time. So say I'm teaching bridge and I don't have time to talk students into upward bow. So I might just say, oh, if you do upward bow, you can do that now. But these days, I'm less inclined to use that strategy. It is a time-saving strategy that is useful if you're teaching all levels classes and you've got students who want to do more complex movements, but all you've got time for is to teach the movements for the general participants, right? That it is a useful strategy for that. I found that when I used that strategy, I kind of opted out of teaching people how to do those things. I just kind of threw that out there. And so students who already knew how to do it would do it, and students who didn't would kind of look around and then try and do it themselves. And here I am, a yoga teacher. My job is to teach people how to do that. So these days in my teaching, my preference is that if I offer something, I teach it. It's a challenge. The reason we use that strategy is we know we don't really have time to teach it, right? Especially if you're teaching in the gym or the studio, you've got 55 minutes to teach your class, and you've got students who are eager to do these things, and you don't want to hold them back and say, you can't do that because I'm not teaching it. But so it is a challenge to navigate that. One of the ways in the past I did navigate that is by teaching two versions and teaching a pose twice. So in the case of something like upward bow, teaching bridge, coming out and then saying, if you want to use bridge again, that's your practice for today. You know how to get into it. We're going to do another round of bridge. If you'd like to give this upward bow a try, here's how you're going to do it. And then I would guide step by step into that upward bow, right? So that students who aren't going to use upward bow have a place that they're going to go to. And then I've got a chance to give some step-by-step instructions leading into that stronger, more complex version of the pose. And I can keep an eye on what's happening around the room. It also gives me space to talk about any contraindications before leading into that pose. Yeah. So that students aren't self-teaching themselves poses by looking around the room going, that looks cool, I'm going to try it, right? Again, that, you have to leave enough time for that to happen, right? I recommend the same thing or similar with any really complex pose, is to teach an accessible version first, take a break, let students have a few breaths to feel how their body's feeling, while you can then talk about, I'm going to offer another version. You've got this version you've just done. You know how great that feels. If you want to add on, I'm going to be talking you through this other version. You might try it and love it. You might try it and say, no, I want to go and do this version, right? And so it gives you that little bit of time and space to start to offer some more complex poses without all the students feeling like they have to follow you in that direction. And again, you just have to leave time for that. Last thing I want to talk about is, how do you know if someone has a health condition? A lot of times, we've just done a talk on this. So if you want to look back to, I don't remember what it was called, but it was something that I can tell you about when it comes forward in my mind. What kind of screening tools are we using when students come to class? If you're teaching in a fitness facility, often you're not doing any screening at all because they've signed up with the gym and they're just coming into your class. And if you're teaching in a studio, often you're not doing that intake as well. So generally, the only time you're screening students yourself is when you run your own classes, so that you can do some screening and help students understand who might need to see their doctor before starting a yoga practice, right? So this can be a challenge. So rather than looking around the room saying, does anyone have a private medical condition that they want to announce to the room? Which usually they don't. You might tell students in advance of a pose, if you've got, and you don't even have to talk about medical conditions. If you've got pain or tension in your wrists in this pose, you can try this. If your knees don't like this pose, you can try this. If you feel a little bit of pressure in this pose in your head, or you get a little bit dizzy, you can try this, right? So you're offering those tips all the way along to let people know. That's going to help students to make choices for themselves. It's going to help them to check in with their bodies and to have to put the responsibility back in the students' hands. They're the ones who know their health conditions. They're the ones who've been advised by their doctor what to do and maybe not do. And you're just coaching them to remember that medical advice and then choose options that best suit them in yoga class. Does that make sense? Even if you do gather information from students, they'll lie, they'll omit things. I used to tell this story all the time in teacher training that people will sign up for class. No, I don't have any health conditions that might be made worse by yoga practice. Sign my name. And then in the middle of the class, they'll say, oh, well, I just had that hip replacement last week. Should I be doing this pose? And you think, what? Use that information as your teacher. And I used to tell this story all the time in teacher training. And one of the students, Ellie, wonderful yoga teacher, she told me later on that when I told that story, she was like, Heather, she's always exaggerating, right? So dramatic. But when she began her teaching practice, this literally happened to her. Halfway through class, a student said, oh, my physio would be so mad to know that I was here doing yoga. I've just had a hip replacement, but I really needed the stretch. How are you as a yoga teacher going to be responsible in that environment, right? Your students not disclose something quite serious. They've made a conscious choice to do something they know they shouldn't do. What's our responsibility in that situation, right? So to me, rather than overly relying on screening tools or getting students to report their health conditions, throughout class, we can be offering versions, right? If you don't want your head so far below your heart, you can try this. Do you get a bit dizzy coming out of this pose? Here are some options, right? So that students who haven't reported any health condition, who maybe haven't gotten guidance from their doctor, can still be safe in your class. Like there they are in your class, right? There's a couple things I'll say about that. If you're like, this is very serious, this person should not be in this class at all, you can invite them to do some of their favorite stretches and then enjoy Shavasana. If someone looks like they're in medical distress, stop your class, call an ambulance. Do not let someone in medical distress leave class alone while you carry on teaching. Put everyone in child's pose, check in on the student. If you think this is serious, move all the other students out of the room and get an emergency response team there, whether it's a physical health issue, medical issue, or a mental health issue. How often is this going to happen? Not very often. I've called an ambulance once in my almost 30-year career. But you want to be prepared for it to happen because it can sneak up on you. And for me, I've always had this nonsensical urge to keep the flow going despite things happening in the room. So if you've got a student who halfway through class has a medical emergency, mental health emergency, or they say, oh, I just had back surgery, should I be doing Cobra? You can stop the flow and deal with that situation. No, you shouldn't be doing Cobra. In fact, I'm not sure this is the right class for you. How about I set you up for a nice Shavasana while we finish up class? And then we can talk after class about what you might do going forward, right? If you're really worried, stop them moving. Like if someone's just had back surgery and feels like doing Cobra, they can do Cobra at home. But if you're uncomfortable having someone do something dangerous in front of you, stop. Yeah. You do have a responsibility in that space, but what we want to do as teachers is hand the personal responsibility back to our students. You know your body, you know your health condition, you make choices. Here are choices. I can provide guidance, I can provide choices, and then you take up those choices based on what works best for you, right? So we're sharing that responsibility with our students. If you have a student that you can't trust to practice safely, and this is rare, but it happens. If you have a student you can't trust to practice safely, you can refer that student on. You don't have to have that student in your class, especially as a new teacher. If that's going to occupy all of your time and attention whilst teaching, you can politely and kindly suggest that they find another class that suits them. Yeah. Again, it's very rare, but it does happen. Can I be clear? You are not going to be calling the ambulance every day and firing students left, right, and center as a yoga teacher. These are rare occurrences. Usually the situation is going to be that someone says to you, my shoulder's achy today. My knees don't like it when I kneel on them. What can I do? And now you're going to have some ideas to offer them. Okay. When we create an environment where students have agency, students feel responsible for their own bodies, students are encouraged to feel what's happening now and act on that, then they're going to make safe choices for themselves. We don't have to be mind readers and body readers to know what a student should and shouldn't be doing, because we can't really know. So creating an environment where students have agency, they're empowered to make choices, and they're offered options, that's the kind of environment that creates safe, beneficial practice, right? And that's the yoga, right? Yoga isn't following some teacher's instructions and orders and having a teacher tell you what you should do with your body. That's not yoga. Yoga is you learning about yourself, understanding yourself, feeling what's happening now, and operating from that place of self-knowledge, right? So that's the kind of environment that we want to create in our classes, so that students are able to make choices. We don't have to make choices for them, right? And so all of that comes from, like what Trudy's saying, offering options, and creating an environment where students are empowered to choose. And that is going to include some strategies like using invitational language, using suggestive cueing, offering, you might like to maybe, here's an option if you want more support, if you want more challenge. All of those strategies work together. All the strategies you're learning in this course work together to create an environment where students are making conscious choices. And when it comes to contraindications, when it comes to risk management, when it comes to safe, beautiful, joyful practice, it's in making conscious choices that we do our best to provide that kind of environment for our students. Sometimes we take the attitude from general life into yoga, like I should be able to, or like my mind is telling me to do this, but my body's saying no. Who should I listen to? I think it's great if we can talk openly about that and talk about working with your body as it's showing up today, which might be different from how it showed up yesterday and how it's going to show up tomorrow. I think those are great conversations to have with students, so that they can be getting to know themselves better and following their own body's wisdom and their own direct experience, rather than the shoulds and shouldn'ts imposed by someone else, right? Not everyone with carpal tunnel is gonna not bear weight on their hands. Not everyone with back pain shouldn't do certain poses. Like it is quite individual. So giving students options and getting them to feel what options feel like, I think that's great. And I think that it helps you as a teacher to not feel like you're holding life and death in your hands when you're teaching yoga. You shouldn't be. That is not your responsibility, right? Okay. We talked about contraindications. I hope this has been useful for you. I will put the recording up in your Dropbox. There'll be an edited version on YouTube, and there'll also be a transcript so that you can print out a list if you want to have that resource available. And I look forward to continuing the conversation. Thank you so much for those of you who are here. Hello to those of you who are listening to the recording. And I look forward to seeing y'all next week. Thank you very much.